It's not unusual for nurses to work on 12-hour shifts, treating several patients in each of those shift at times. A small study conducted by WSU researchers at Kootenai Health in Coeur shows working a 12-hour night shift affects a nurse's performance more than working a 12-hour day shift does. Now, researchers at Washington State University are digging deeper. They are taking 50 nurses working day shifts and 50 working night shifts from Providence Sacred Heart Medical Center in Spokane. These nurses head to WSU Spokane for testing immediately following 3 consecutive 12-hour shifts just to see how they're holding up after a long day at work. Our Nikki Torres spoke with the researchers behind that study. It's a story you'll only see on 4 News Now.
In the hospital, your life may be in the hands of your nurse, a nurse who could have already worked 9, 10, or more hours by the time they see you. Do those long 12-hour shifts affect the care that you get? Does one shift make nurses more tired than the other? And is it even safe for them to drive home after working all those hours? These are the questions researchers at WSU are trying to answer.
Hey, Miss Smith, how are you doing today?
I know what you're thinking. That's not a real patient.
This is the Clinical Performance and Simulation Lab here at the College of Nursing at Washington State University.
Miss Smith is a robot. Researchers are using her as part of a 3-year study.
This is Miss Jill Smith, and she is in here because she had fractured her hip and had a hip replacement. And so they would walk in here again just like as if they're walking into a patient room.
Spoiler, this isn't a real car either.
Something might cross in front of you, like a pedestrian or an animal.
These are both simulators that researchers are using to test 100 local nurse practitioners.
Look at the impact of cumulative 12-hour day versus night shifts on nurse safety and performance.
Nurses treat a couple dozen patients in just one shift. How well they do their job starts with their well-being. You remember Jill Smith? She's part of the study.
They'll get into medications, they'll get into IV fluids, whatever else is needed based on what's going on with her and her scenario.
Nurses come in one at a time and treat the patient as if she were human.
So I'm just going to take your vital signs. I just want to listen to your lungs real quick.
Researchers are studying several factors, including accuracy.
When I'm looking at running the simulation, I'm looking at are they doing the correct medications and are they taking care of a patient like any other nurse would.
They're also studying a nurse's judgment after all those hours on the job.
If she's in pain, are they addressing the pain? If she's low on oxygen, are they addressing that?
I'm clearly not a nurse, so I didn't participate in this part of the study, but I did get to try the driving simulator.
Okay, climb on in.
It was like being in a video game, only this was serious. You have to watch your speed and make sure you're paying attention.
Let's try and maintain within the lane.
Oh, I'm going super fast. Okay. Results won't come out for another year or so, but researchers say they already see a trend.
Sleep results do seem to indicate that nurses following their consecutive 12s seem to be pretty sleepy, and that this appears to be more the case for night versus day shifts.
The study needs 100 participants, and right now they're at about 75% of the way there. Researchers say they'll wrap up testing in about a year, then they'll spend the rest of the study analyzing all the results they collect. Reporting in studio, I'm Nikki Torres, 4 News Now.